It's Dr. Fawad Mian. Today, I'm going to talk to you about getting better sleep. So, sleep is something, unfortunately, as time goes on, we're getting less and less of because we're constantly busy doing many different things throughout the days. We're responding to emails, text messages, and it's a 24/7 thing, as opposed to many years ago when we didn't really have any of that. Thing stopped by 5 o'clock at the end of the day. One of some things that you can do at home, which I think are very beneficial, are number one, definitely turn off your electronics at least 1 to 2 hours before bedtime. Because basically the light from those devices essentially tell our brains to stay awake. And so it's almost like opening up the blinds in the morning. So simply by just turning off those things, it helps eases your mind. The other thing is also being on these devices makes people want to continually be on them. And a lot of times, sometimes they're going to be mindless scrolling through things too as well. It just keeps your brain to keep going rather than letting it slow down by itself. Um, Some other things are actually very important too as well, is just making sure that you get your intrinsic sleep checked. So if you're kind of having fragmented sleep, one of the things that we do is actually a sleep study, and that measures not only your breathing, but also looks at some of the behaviors you may have during sleep that you're not aware of, and also lets us look at some of the leg movements that you may potentially have that could be fragmenting your sleep. Obviously, if you have any breathing issues, it may be suggestive of something called sleep apnea. Sleep apnea can be associated with many different things from increased weight, for instance, which actually can lead to increased propensity of this. But also, there also can be genetic craniofacial abnormalities that also can affect people and cause this problem. One of the things that I always encourage people to do, especially with just the increased weight and having sleep apnea, for instance, is we want to encourage people to actually work on the weight. So that means you're obviously modifying your diet with various different diets, but then making that very consistent over time. As there is actually increased fat deposition within the neck and as well as the abdomen, what happens that puts pressure on different organs as well as the lungs and other organs essentially, and that actually can help perpetuate things. Granted, most of sleep apnea tends to be further down over here, but just having the abnormal abdominal circumference can actually have an impact on that. So losing the weight essentially, even like around here, and just throughout the entire body can make a big difference between being on a CPAP, which is just a fancy word for a box that blows air into you that has a mask and a compressor hose. That's all it really is. Versus, doing something like an oral appliance or even just using positional therapy, which actually can be helpful. One of the things that we actually do, aside from guiding people with some of their weight, is also something called the emerald laser, which actually helps reduce some of the abdominal circumference, which actually can help mitigate somebody who has essentially mitigate some of the pressures that people have when they're utilizing CPAP. And for some people, if they combine it with diet and weight loss too as well, and just being consistent with that, can help them get them off these things too as well, provided that the sleep apnea is mild enough. Obviously, if it's very severe, it's not going to change it that much, but if it's more on the mild side, definitely makes a huge difference too as well. So the other thing also I tell people for just getting better sleep too as well is definitely making sure that you get exercise during the day, because that's also going to increase a little bit of sleep pressure. But the earlier you do it during the day, the better off you're going to be. But you don't want to do it too late at nighttime because that's actually also going to rev you up and make it harder to sleep. And then probably one of the most important things I tell people is if you can't sleep, don't stay in bed. That means getting out of bed, going to another room, not cooking, not cleaning, not eating, getting on any electronic devices. It's simply staying off that stuff, reading something mundane or listening to light music. And once you go sleepy, then going back to bed. And sometimes this takes a while to help break that habit so that eventually you get to the point when you lay on your bed, you're simply there for sleep and that's it. You fall asleep much faster versus you're thinking about various different things or you need to do other different tasks or whatnot. With sleep, if we don't get enough of it, it has a profound impact on the rest of our body in multiple different ways. One of which is it affects our mentation, our mood, which a lot of people are aware of. So if you're constantly sleep deprived, not only are you going to forget where you put your keys or where you parked your car, you're more likely to be grumpy, more irritable, but that's not the end of it. What happens also is that the hormones in your body start changing too as well, which can have a profound impact on your health. You actually also increase more body inflammation by not getting sleep because your body really needs rest. if you have any intrinsic sleep disorders, which also is disrupting your sleep, like sleep apnea, for instance, there's also increased risk of things like high blood pressure, stroke, heart attack, arrhythmias of the heart. So they can be quite detrimental. So just making sure that you get the proper sleep can pay dividends, not only for your mental health, but also for your overall body health too as well. If you guys have any questions or comments or would like to chat with us, feel free to leave a comment or question for us, and our team will get back to you as soon as possible.